If at all there is something, you should visit a doctor, and a gynecologist would be the first person to go to. Hello dear friends, I am Dr. Sumi Peter Maria, consultant and infertility specialist at Milann Hospital, Delhi. So today I will be answering the most common questions patients have towards gynecologist. So the first question they ask us is, when is the first time that they need to visit a gynecologist? So visiting a gynecologist isn't just about when you have problems. So it is understanding when all you can go and meet her. So here I will tell you the various scenarios in which you can meet a gynecologist. So it could start anytime from your teenage till your reproductive years or anytime after that. So let us start from understanding the problems in each age group. So teenage is a time where our body undergoes a lot of changes. There are a lot of hormones coming in, a lot of changes in our body pattern, something that we rarely understand. So it is very important to have social, physical and mental support in this time. So here we need to understand that there are a lot of things that a teen might be facing. 1 year after you get your periods for the first time, you could have irregular periods, and that is normal because your central nervous system is immature and that axis is yet getting mature enough to have regular periods. So that is normal. But after 1 year, if at all you have irregular periods, it might not be normal. So that is when you will have to meet a doctor. Now, how do you define a normal period? It is something between 2 to 7 days, and it happens once in 21 to 35 days, and the bleeding is like normal. And each bleeding lasts for something like less than a week's time. So here what we need to understand is, if at all you get period in less than 21 days or more than 35 days, that is abnormal. If at all you are having excessive pain during your period, that is abnormal. If at all you are experiencing something like a flow with passage of clots, that could be abnormal. So don't ignore these symptoms and always make it a point to meet a doctor. Then there could be changes like you have excessive weight gain. There could be changes in your hormones like the thyroid hormone. You have something called a prolactin hormone which could be impaired, or there could be something that could be related to your excessive hair growth pattern in your different body parts like your jawline, like around your nipple, lower part of your abdomen, in your thighs, etc. So all these could be a warning sign towards something called as polycystic ovarian syndrome, which we hear a lot these days. So those are the things we need to keep in mind. Now there is one thing which is very common and very much important here is that if at all you or your child does not develop secondary sexual character, which is like the development of breast by the age of 13, or if she does not have period by the age of 15, in spite of having breast tissue, is when you need to take her to a doctor to see whether there is any problem. So don't wait for her to reach the age of 18, 19 or till the time she wants to get married for her to meet a doctor. So these things need to be understood by you and should be taken care of. Now we reach the reproductive years, which is like our 20s to 30s. So the problems here also could be anything related to periods, but there are also other things which are outside that. So it's not just about period, it's also the time we want to have our pregnancy planning. Also, we need to understand about contraception, where we have to do family planning also. And there are a lot of common disorders that a gynecologist sees, which is like urinary infections, vulvovaginal candidiasis, which is the fungal infection, and a lot of vaginal secretions, and whether they are pathological, foul-smelling discharges, lower abdominal pain, infection of the uterus. So all these are quite common. So understanding the problem with period is something that I've told earlier. So that happens all along the time that we are having period. So it ranges from teenage to your reproductive years. So other than the problem with your period, what you need to understand is the other disorders that come up with as you age. Also, one important thing here is understanding infertility and when you need to see a doctor for infertility. So infertility is when you are with your partner and you are not able to conceive even after trying multiple times with unprotected sexual intercourse for almost 1 year. So that is when you can meet a doctor and have preliminary investigations done so that the doctor can guide you further as to how to go forward with. Now coming to our 30s. 30s is the time when our ovarian reserve is what the number of eggs that we're born with. It comes down. So as you are in your 30s and that's the time when you start planning your pregnancy, we need to be a little more careful. So here we need to understand that a woman in her 20s and in her 30s are totally different in the way they might respond to becoming pregnant. So then you can meet your doctor, you can plan your pregnancy and also run a few investigations to see if everything is quite normal, and then you can try. So once you are beyond 35, you are almost in the age group where you might need little assistance. So you cannot wait for around 1 year for trying to get pregnant. So if you're trying for 6 months and then you are not getting pregnant, you should meet your doctor. And also that's the time when you will have a lot of other disorders also, which are very common, which includes fibroid, adenomyosis, etc. So if you're having irregular periods, excessive bleeding, painful periods, etc., please meet your doctor to run a few investigations, do a basic ultrasound to see if everything is normal. And also you might have to do something called as a fractional curettage to see if your hormones are all functioning properly, and let us guide you in a proper way so that you don't have to suffer. So that is in your 30s and your early 40s. Now, once you are reaching your menopause, or that is called the climacteric, you will have symptoms that will be like reduced periods, irregular periods. So that is when your periods are almost coming to an end, and also excessive bleeding, etc. So this is the time where you can also have something related to urinary incontinence, like you have difficulty in holding your urine. So for that also you might have to meet the gynecologist. Also, you should see whether there are other things, like once you develop diabetes, you can have excessive incidence of urinary tract infection. So all these general metabolic disorders are also very common once you age, and these have to be controlled so that our gynecological disorders are also be controlled. So once you are after your menopause, that is postmenopause, and you have bleeding. So how do you define a postmenopausal bleeding? It is when you have bleeding after 1 year of stopping of your periods. So your periods have stopped now and you get your bleeding 1 year later. That means that it is a postmenopausal bleeding. So any postmenopausal bleeding needs to be evaluated. So please don't ignore this symptom, and please visit a doctor to see what is wrong. So the doctor will be basically looking at you, doing an examination to see everything is fine. We'll be doing a scan to see what is the lining of your uterus, what is the thickness of that lining, whether there is anything wrong with your ovaries, whether there is anything wrong with your cervix, and all that. So she will basically guide you further. Also, once you are postmenopausal, you have to also look for warning signs like loss of appetite, loss of weight, which could be ignored. But then these are the symptoms which will guide you in telling whether there is any underlying pathology, that like in the ovaries, the cancer of the ovary, cancer of the endometrium, cancer of the uterus, etc., will be guided by these small symptoms. So these are the things that we need to keep in mind, and always make sure that it's not just about going to a gynecologist when you have symptoms. Please make it a point to visit a gynecologist once in every 1 or 2 years. So this is just for a routine checkup to see if everything is going fine. And also, once you are in your reproductive years, make a point to do a pap smear, which is the cervical screening program, once in 3 years before 30 and once in 5 years after 30, so that you are sure that there is no cervical cancer. Along with this, people who have familial cancer tendencies, they can also visit a gynecologist routinely to see if everything is going fine. Now, this is just about the uterus, ovaries, and tubes. Also, I request all women to undergo a self-breast examination every 6 months to see if there is any lumps in your breast. Also, there are any changes in the color or the size or the shape or any nipple discharge, so that you will be aware that if at all there is something, you should visit a doctor, and a gynecologist would be the first person to go to. So these are the things that we need to understand and we need to look forward to. So it's not just about looking beautiful on the outside, it's also looking beautiful and being good inside. Thank you so much.